Hi, my name's Alan Prost, and I'm going to give you a little demonstration today on the Respironics BiPAP Visions ventilator. And we use this for non-invasive ventilatory support. So usually a patient will have either a full face mask or a partial, just a nasal mask, to augment their own spontaneous breathing. Now, on this particular ventilator, it calls it BiPAP, but it's the same mode as pressure support that we've been studying in class. So, the first thing we're going to do is we're going to hook it up. So, we need an oxygen source and, of course, some electricity. Now, this ventilator only needs oxygen because it uses room air for most of the flow delivered to the patient, and just oxygen to augment the FiO2 the patient requires. So that just plugs right in here to the wall. All right. Now, the on switch for this particular ventilator is just on the back here. It's just a little white switch that we just flick onto the back. All right. Now, while it's doing that, I'll show you the patient circuit. I've already got it attached, but it's very simple. And what we have here is we have the patient connector is this little part right here, and you'll notice it's got a hole in there, and that's not an accident. On this ventilator, we want that hole there because that's where the extra flow of gas is vented through there to prevent rebreathing of gas through the system. All right? This has only got a one-way circuit, so there's no exhalation section on this. There's just a continuous flow of gas through the circuit. This here is a little pressure manometer line that the ventilator uses to monitor the patient pressures. So it hooks up on the ventilator end straight to the ventilator here, all right, with this little, just a simple circuit, and here's our pressure manometer line. So it just plugs right into the front here, just like that, and right here to the pressure port. One of the things you should do with this ventilator when you're just starting to use it is you should test the exhalation port. And this is where the ventilator learns how much flow is actually going through this little port right here, and to make sure it's functioning properly. So the way you do that is we just hit test, and it actually describes the procedure right here on the screen for you. So I'm just going to include the circuit and start the test. All right? What it's doing, it's actually measuring the amount of flow that is constantly going through the circuit through that little exhalation port right there. So once the test is complete, we can actually put the ventilator in a standby. So I'm just going to get you come a little closer here so I can show you how this ventilator is set up and used at the bedside. All right, so we're going to use this ventilator in the mode to augment the patient's own spontaneous efforts. So when I go push monitor here, initially I'm just going to put it in a standby until I get all the ventilator settings that I want established on the ventilator. Then we can select our mode. Now, we have a variety of modes. We have CPAP and we have proportional assist ventilation available on this ventilator, but we're going to use the ST time, the spontaneous timed mode. All right? So if I were to select the CPAP mode and then go into modes, you'll notice that the ST is available there, and that's the one we're going to use and work on today. And then I'm going to activate the mode. You notice a little screen here flashing at me to let me know. All right? Whenever you want to put the ventilator in a standby, just hit the monitoring mode here, all right, and the standby option will become available to you. Okay? So, in this mode, we can set up certain parameters. Now, it calls it IPAP, EPAP, all right? Inspiratory pressure, expiratory positive airway pressure. Inspiratory positive airway pressure, expiratory positive airway pressure. The IPAP is the same as your pressure support level. So as the patient breathes in, the pressure in the circuit will be augmented and increased to decrease the patient's work of breathing. So just like pressure support. The EPAP is exactly the same as your PEEP level, all right? So I'm going to set this up today. I'm going to set that up to deliver 12. Notice I just tap the button and it'll secure that, and an EPAP level or a PEEP level of 4. And I also have the availability of a backup rate in this mode. Right? Now, I've got it set here at 4. You can set that to whatever you like, but it's set at a minimum of 4. But that rate only kicks in if the patient goes totally apneic. All right? If they're breathing above 4 breaths per minute, the ventilator will just be like in regular pressure support. So it's kind of a backup safety system. All right? If we are delivering a rate of 4, it also lets me set the TI, or the TI during inspiration. Now, that TI will only be kicking in if the patient goes apneic or takes a prolonged inspiration. It'll limit the TI to 1.5 seconds or whatever you set there. And I've got it set at 1.5 seconds. That's not a bad place to start. Now you will notice that if you're spontaneously breathing in the circuit, like I'm going to show you in a second, this only comes in if you take a prolonged inspiration or you go apneic. Otherwise, it's flow cycling. So when we look at our classification system, this is a patient-triggered, pressure-limited, flow-cycled ventilator, just like pressure support. So I'm going to put my mask on here, and just like for you in the lab, we've got just a simple mask here. I've got some headgear that I can apply to my patient to hold it in place. Initially, I'm just going to hold it on, just like you would with your patient. I also have a little filter here, just so that I'm not breathing any of the debris through the circuit. All right. So I'm going to put that on there like that. All right. All right, so what you can see there is that during inspiration, I was getting the pressure, the IPAP pressure set on the ventilator, and it's maintaining a constant EPAP or PEEP pressure during exhalation. All right, so it's cycling back and forth. All right, I'm just going to put it back into standby. All right, so this is a really interesting mode. It will augment my patient's inspiratory efforts with the IPAP, right? So right now I've got it set at 12/4, and we'd adjust that IPAP level to decrease the work of breathing of the patient. So if my patient was particularly air hungry or short of breath and had a high respiratory rate, I would increase that until they were comfortable and had a lower respiratory rate, that to 12 to 18 breaths per minute, and a reasonable tidal volume. Now, while the ventilator's on, you'll notice on here that while I'm breathing, you can see my tidal volume and my minute ventilation. So I'm going to try breathing on this again and taking it out of standby. To take it out of standby, as soon as your patient breathes on the circuit, it'll come out of standby. Watch this. So you can monitor your patient's tidal volume, respiratory rate right off the ventilator, and augment their FiO2 to keep their SATs up into our goal of about that 90 to 93%, all right, or as per ordered by the physician. So if you want to adjust the FiO2, just hit the button here. Now you need to take it out of standby to do that, and then you can adjust it on here, all right? So once it's out of standby, so once it's ventilating the patient, you can establish the FiO2 as needed to meet their patient's oxygenation requirements. All right. So if I go into parameters, I can adjust that FiO2 to whatever the patient needs. Okay. So my name's Alan Prost, and that's a really basic introduction to the BiPAP Visions ventilator. Remember, it does have some other modes. It's got just straight CPAP and proportional assist ventilation, which we're going to talk about more in class. Thank you very much.